Hi everyone. Most of the common term in the knee injuries, most of might have heard about meniscus. Meniscus is nothing but a small cushion-like structure in the knee. If you see between two bones, in X-ray if you see there will be a gap. Actually this gap is filled by this soft cushion-like structure called meniscus. Meniscus is it's like a shock absorber in your knee. It can be torn in certain cases, like in an accident, road traffic accidents, or any twisting injury, most common in the sports injuries. So people get toppled or got a sprained knee, they will have that meniscus tear. So meniscus tear is such a common diagnosis. If you get an MRI also, it shows as a grade 1, grade 2, grade 3, grade 4 tears. Actually grade 1 and grade 2 are a very minor thing, non-significant, because MRI picks up edema, means some contusion, some bruise like thing into the meniscus. But actual tear gives problems. Once the meniscus tear is there, the symptoms of the patient might feel it's not the pain, they will feel like a locking sensation. It's like after a few steps they will see that knee is not supporting me or getting locked in certain positions, or if I bend my knee in extreme positions, then I will have a pain, because meniscus will come into the picture that will drag the surrounding tissues, that gives the pain. Any meniscus tear doesn't heal on its own because it's lack of blood supply. The tear will propagate if you neglect it. So when the diagnosis happen, most of the times it will happen with MRI. Once you have symptoms, if you consult your doctor, the symptoms are matched with the findings, then we ask to get an MRI scan. Once the MRI scan proves there is a significant tear that is troubling you, then it might require you need to go under operation, under knife. That is a keyhole operation. We need to rectify the tear, and nowadays we will try to preserve the meniscus and give the normal anatomy to that, so that you will have a original feeling in that. If the tear is irregular and it is not able to repair, then we need to sacrifice that part of the meniscus, whichever is torn. Because if you neglect the tear will increase. It's never going to heal on its own in the knee, because knee doesn't contain any blood supply inside. There's a gel-like fluid will be there that will hinder the healing. So the tear will propagate with your movements or friction. So for any meniscus tear, if you suspect or if your MRI shows that every meniscus doesn't require surgery, but certain meniscus tears cannot be neglected as such also. If you neglect it, the tear will increase. If you get it treated early, the results also will be good. If you get treated neglected tears, the results also won't be good. So it is very important, whenever you have the symptom, any trouble in the knee, get a proper advice from your doctor. And most of the times it can be solved with the physiotherapy. Sometimes beyond physiotherapy, the tears don't expect that will heal naturally. It requires right treatment at right time. If you neglect it, the results are not as good if you get treated as early as possible. So don't try to neglect any tears. Get it treated properly, whether it is operative or non-operative. Consult your doctor first.